Welcome to our simulation lab. Today's session we will be demonstrating a complete bed bath. Keep in mind this is a session where in addition to attending to the patient's cleaning of the skin from head to toe, we will also be attending to those areas where the patient may not be able to assist themselves, including combing of the hair, nail care, and mouth care or oral care. We have a bath trolley set up for you today with all of the items that will be needed for the procedure. Starting from my left and going to the right, we have two basins. One would be for clean water. Both have clean water, but one would be for washing with soap and the other would be for rinsing. We have a container with gauze squares or cotton folds and gloves, and this jug will also contain water, and that will be used for perineal care or the mid area when you are attending to that. So specifically that is set aside because that will mean that you have to don gloves to clean that area. We also have items for hair care, including comb, any hair product that the patient may use, and a drape to protect the clean clothing that the patient may be wearing. In terms of nail care, we have gloves. We also have a drape for collecting clippings underneath the fingernails, and we have a small kit with a nail clipper and file. We also have an orange stick for cleaning under the nails if they are obviously dirty. We have mouth care items, including a cup for the patient's dentures. We have a drape for the patient's clothing as well. We have toothbrush and toothpaste for those patients who have them and are able to use them. You may have to hold the toothbrush for the patient, and for the patient who cannot use a toothbrush or does not have a toothbrush available, we can also use spatulas with gauze, wrapped in gauze, for cleaning the mouth. We have more gauze available. In addition to toothpaste for cleaning the mouth, we also have mouthwash available. We have our soap for our tidying. Our patient may have their own soap, or we may use whatever standard wash or liquid material may be available in order to clean the patient's skin. Of course, we use gloves whenever we are coming in contact with direct skin and there's likelihood that we are cleaning blood or body fluids. We also have a bath thermometer, which we can use to assess the temperature of the water that we're bathing the patient. In the absence of the bath thermometer, you can simply use your elbow and dip very carefully into the water to determine the temperature of the water. Usually lukewarm is appropriate for tidying the patient. But the water must never be too cold or too hot. We also have bath wipes that can be used for cleansing the skin. In addition to the two basins we have here for water for washing and rinsing, we have an additional basin so that if you do need to rinse the patient's skin again because they may be very sweaty, very dirty, you don't have to leave the patient to go to get another basin for rinsing. So you have a third basin here that can be used for either washing or rinsing if you need to do that. We have on the left, underneath that basin, a pail so that as you wash the patient and you want to remove the soiled water, you can empty it into the pail. Just left of that bin, we have another bin that we would discard soiled items, soiled disposable items such as gauze squares or wipes that we use for bathing the patient will be disposed of in this bin. On the second level of the trolley, we have two large jugs, which we will put our cold water and our hot water, so that during the bed bath, if we need to change out these water that have become used, we can pour them out into the basin and then pour additional water without leaving our patient to go to our sluice or our preparation area. Everything is readily available right in front of us. So our cold water and our hot water, and we have also, next to that, we have a urinal for our male patient if he needs to void, and we have for our female patient if she needs to void, and particularly when it is time to do the perineal care, we will place the female patient onto the bedpan where water can be poured and she can wash the vaginal area and the vulva thoroughly and very clean. When the bed bath is complete and we have met all of the patient's hygiene needs, including cleansing of the skin from head to toe, mouth care, hair care, and nail care, we will now proceed with dressing, grooming of the patient, and also changing of the bed linen. We need at least 2 rags, which one can be used for washing and one for rinsing, so at least 2. But if you have more, it tends to make it a little easier to tidy the patient in bed. You also need 2 bath towels. One is usually used for draping and the other is used for drying of the skin. So once that is completed, then we would go on to dressing the patient and also changing the bed linen, and those items are set up on this clean table as well. You have your linen, which is stacked from top to bottom in the order that it's going to be used, and that makes bed making much easier and much more efficient. You also have the patient's clean gown or nightie, pajama that they are going to put on next, and on any underwear if they are going to don same. Not seen here, but you would have those hopefully for your patient. In terms of grooming, you may have your skincare items such as your oils or lotion, deodorant, or any other item the patient may want to put on onto their skin to feel fresh and clean and pleasant to interact with others. And those are the items you would need for bed bathing. This item is called the linen runner, so that when you make the bed and you remove soil linen, it goes into this receptacle to be taken away. We are now going to perform the complete bed bath procedure, and at the end of this procedure, the goal is that the patient will vocalize feeling clean and fresh. We will review the chart for any limitations in physical activity and to be able to determine how much the patient will be able to cooperate and assist in her own hygiene needs, meeting her own hygiene needs. We bring the necessary equipment to the bedside stand or overbed table. We perform hand hygiene and put on gloves and or PPE if indicated. We identify our patient using our 2 identifiers, addressing our patient by name, asking them their full name, and also checking the ID band. We discuss the procedure with the patient and assess the patient's ability to assist in the bathing process, as well as their personal hygiene preferences. We close the curtains around the bed and close the door to the room if possible. We are to adjust the room temperature if necessary. If fans are there, we take off fans so that our patient does not get chilled. We are to remove sequential compression devices and anti-embolism stockings from lower extremities according to agency protocol. Offer our patient a urinal or bedpan. Remove those gloves and perform hand hygiene. Adjust the bed to a comfortable working height, usually elbow height of the caregivers. Perform hand hygiene and put on PPE if indicated. Identify the patient and explain the procedure to the patient. You assemble equipment on the overbed table within reach. Close the room door or curtains. Provide privacy to the patient. Place the bed at an appropriate and comfortable working height. Lower one side rail so that you can access the patient on the side, and position the patient with the head tilted forward. Place a towel across the patient's chest and the emesis basin in position under the chin. Put on gloves. You are to gently open the patient's mouth by applying pressure to the lower jaw at the front of the mouth. Remove dentures if present. Brush the teeth and gums carefully with toothbrush and piece. Lightly brush the tongue. Use toothette dipped in water to rinse the oral cavity. If the patient can gargle and rinse on their own, allow them to do so. Place the emesis basin under the chin so that the patient can spit into the emesis basin. Clean any dentures before replacing. Apply lubricant to the patient's lips. Remove equipment and return patient to a position of comfort. Raise side rail and lower the bed. Remove additional PPE and perform hand hygiene. Document the procedure. Put on gloves. Lower the side rail nearer to you and assist the patient to the side of the bed where you will work. Have patient lie on his or her back. Loosen the top covers and remove all except the top sheet. Place your bath blanket over the patient and then remove the top sheet while your patient holds the bath blanket in place. If linen is to be reused, fold it over a chair. You place soiled linen in the laundry basket. Take care to prevent linen from coming in contact with your clothing. Remove the patient's gown and keep the bath blanket in place. If patient has an IV line and is not wearing a gown with snap sleeves, remove the gown from the other arm first. Lower the IV container and pass the gown over the tubing and the container. Rehang the container and check the drip rate. Raise the side rails and fill basins with a sufficient amount of comfortably warm water. The temperature should be 110 degrees to 115 degrees Fahrenheit. You can use your bath thermometer to assess the temperature of the water. If the elbow is exposed, you can also use the elbow by gently placing it into the water to assure that it is the correct temperature. Lower the side rail closer to you when you return to the bedside to begin the bath. Wet the washcloth, squeezing out any excess water, and fold the washcloth like a mitt on your hand so that there are no loose ends. You can then proceed to wash the patient's eyes. You clean the eye furthest away from you first, from the inner aspect to the outer aspect of the eye. You can then invert your hand and use the alternate corner of the rag to clean the right eye from the inner canthus to the outer aspect of the eye. Rinse your rag and you then proceed to bathe and wash the patient's face, neck, and ears. Again, squeezing out excess water, folding the rag like a mitten so that there are no loose ends as you wash the face, always working from the side furthest away from you and then cleaning the side nearest to you, and alternating between washing and rinsing. She's now cleaning the patient's ears, and then the neck. Alternately, while one person is washing and rinsing, the other person dries the patient's skin with the additional bath towel. Pat drying is preferred. patient's face, neck, and ears are now washed, rinsed, and clean, and dried. We will now expose the patient's forearm and place the towel lengthwise under it. Using firm strokes, wash from the hand to the arm up to the axilla, lifting the arm as necessary to access the axillary region. Rinse if necessary and dry. Pay careful attention to the patient's IV access site so that it does not become dislodged. When you are finished with the left arm, you complete the same action for the right arm. Spread a towel across the patient's chest. Lower the bath blanket to the patient's umbilical area. Wash, rinse if necessary, and dry the chest. Pay special attention to the folds of skin under the breasts. Keep the chest covered with a towel between the wash and rinse. Carefully inspect and clean the umbilical area and any abdominal folds or creases. Pat dry when drying the skin areas. Repeat the same action for the right side. Return the bath blanket to its original position and expose the patient's far leg. Place the towel under the far leg. Using firm strokes, wash, rinse if necessary, and dry the leg from the ankle to the knee and knee to groin. Again, pat drying when drying the skin. The same is repeated for the right leg. Wash, rinse if necessary, and dry the foot. This is an alternative method that can be used to wash the patient's foot and to clean the patient's foot. This can also be applied to the hands first when you do the arms and hands. Keep in mind, you do not submit the patient's foot in water if the patient has an ulcer of the heel or anywhere along the foot or any breakdown in skin integrity. You wash and dry the foot thoroughly. The leg has already been washed, cleaned, and dried. And now you repeat for the alternate right side. The patient has been assisted up onto a bedpan in order to facilitate perineal care. Once on the bedpan, water can be poured from the top of the vulva, flowing downwards to the anus so that the patient can be cleaned thoroughly. If the patient can assist and do this on her own, she may be encouraged to do so. If the patient cannot, then the staff would assist the patient with cleaning the vaginal area. You always clean from top towards the anus. If necessary, you can gently part the lips of the labia majora in order to clean away any smegma that may be present so that the vagina is thoroughly cleaned. Once cleaned, the bedpan can be removed and the patient can be repositioned in bed to continue with the bed bath. Once the bedpan has been removed and the patient repositioned, you can pat dry the perineal area. The patient can now be repositioned to continue with the bed bathing procedure. For cleansing of the male genitalia, the following actions are recommended. You clean around the glans penis in a circular motion. If not circumcised, you can gently retract the foreskin and clean the head of the penis. Once the head is cleaned, you can proceed to clean the shaft from the head of the penis towards the testicles, under and over. You can then proceed to clean the testicle area and the male genitalia is now clean. You then pat dry gently to complete cleaning of the male genitalia. Assist patient to the side-lying position, supported by the rails, or the patient can also be supported by the assistant holding at the shoulder and the hip. Position the bath blanket and towel to expose only the back and the buttocks. You are now going to clean the anal area. Clean as many times as necessary to remove any stools or urine. Once the anal area and the fold of the buttocks is cleaned, you can clean the outer gluteal areas. You are to remove your soiled gloves and change your water so that you can proceed to clean the back area. Your assistant can pat dry the outer areas of the buttocks. Using the mitten, you can clean the back area using firm circular strokes, which massages the area of the skin. You wash, rinse, and dry the back. The patient has now had a completed bed bath, and you can proceed to put on the patient's clean clothing and change bed linen if necessary.